Ruzanna.
Thank you very much for a kind introduction. For today, I will introduce you our new study that we are going to launch. And we all know about the osteosarcoma, that is the most common bone sarcoma among children. And we know that with the use of combined chemotherapy and surgery, the 5-year survival reached around 70% for localized disease, and that MAP regimen, including doxorubicin, cisplatin, and high-dose methotrexate, is currently considered the standard therapy in osteosarcoma. However, in many low and middle-income countries, there is a difficulty in monitoring the methotrexate level, and there is a difficulty in managing the side effects caused by high-dose methotrexate. So we decided to launch this trial and this is called the Papyan, which is a multi-center international non-randomized study of pediatric oncology's Mediterranean Papyan group, which is utilizing carboplatin-based versus methotrexate-based treatment regimen in localized osteosarcoma. So initially it was designed as a randomized study. However, after various of discussion with Papyan group and SIOP team, we decided to do it non-randomized because of the fact that in case of randomization, there will be low recruitment, and some centers had difficulty in terms of randomization. So recruitment period is expected to last for 4 years. So what are we going to do is to have a biopsy-confirmed diagnosis of resectable osteosarcoma, and after registration to have like 2 arms. The first arm we're receiving the MAP treatment regimen, and the second arm OS99, which contains which is carboplatin-based regimen. So a little about Papyan. Which was established in 2013, and this group includes 110 centers and from 28 countries. So this were not possible with the help of Dr. Raisa Papyan, who helped me to design this trial. And of course, the project development with the help of AUBC team from Lebanon, Dr. Hani Tamim, Lara Al-Hakim, and Pardina Bejani. And of course, the project was discussed with SIOP team, who helped us a lot with their insights and input in this protocol. So in 2011, SIOP Children's Research Hospital already showed and compared the historical controls between OS99 regimen and OS91, and just to kind of remember that OS91 was a methotrexate-based regimen. But the problem is that both approaches are being used in low-middle-income countries, but were never directly compared to each other. So aim of our study is to compare the 5-year event-free survival of carboplatin-based regimen and methotrexate-based regimen, and to compare also the response rate, toxicity, adverse. Sorry, and quality of life also. We sent a survey among Papyan centers to explore their interest in participating. This was sent whenever we were planning to do a randomized study, but I'm sure in case of non-randomized study, more people will be interested in joining. So these are the numbers and how many centers were interested. So we are expecting 260 new osteosarcoma cases per year. So how to join, and I would like to ask you all to share us with the data, and not only the data, but just to contact us whenever you have osteosarcoma patients which are treated according to MAP or OS99 regimen. And this is my email address. You just can simply email me. And the thing is that I would like to add is that collaboration is the key to success, and only with the help of the collaboration, especially when it comes to pediatric oncology, we can have a success. And thank you very much for your attention, and I'm looking forward to your questions.